Okay. Okay. Welcome to the second part of Skype webcast with Jean-Francois Esculier. It's great to have you back on the second part. So we had some very good tips on patellofemoral pain. Now this is going to be still running related but totally different. So we're looking into shoes, minimalistic footwear, foot strike, a lot of controversy, and specifically looking into link with injury prevention. Now talking about shoes. We know that shoes and orthotics change kinematics, kinetics, and muscle activation. For example, if you have increased heels, it's going to change your muscle activation. But there are some experts who say form before footwear, and footwear should not be initial focus. We should be mostly focusing on load management and strengthening. So what are your thoughts on the importance of shoes? Is it something, do you think it might not be important in initial stages, or what how do you say that respond to that?
Yeah, actually the form before footwear, I don't agree with that.
Yeah. That's good. We got a bit of controversy. That's good. Yeah.
The reason why is yes, I would agree that form is has the main influence on the way you run, on the impact forces. So on the way your foot lands and so on. So if you say to someone, land on your midfoot or land on your forefoot, they will do it. That's for sure. But if they don't feel the ground, when they get fatigued, when they talk to their friend while running, they will go back to their normal. So I tend to say that I use the footwear at first sometimes, not always, but I don't agree with the form before footwear.
Yeah.
Because footwear has the main influence on form. And if you try by yourself to run barefoot, or you try to run in very, very minimalist shoes, you will not land the same.
Yeah.
It's an automatic reaction of the body for protection.
Yeah. So definitely, there's some people who dismiss that sort of shoes, and I think it's one of the key link between your foot and the ground, and definitely has a massive role. And talking about a little bit on the injury prevention, so I'm sure you're aware of the article by Malisso, who recommended multiple shoe use, and he said runners who use different pair of shoes tend to have a 39% low risk of injury compared with runners with only one pair of shoes. And in my own example, I tend to use different shoes for a sprint-based training or for a long run. Do you think that's something which we should be encouraging more, or what's your view on that?
If I was selling shoes, I would say yes.
Yeah.
We should definitely go this way.
Yeah.
I'm not. So when that research came out, all the retailers, they were there and saying, this research said that you need more than one pair of shoes. What I tend to do, because I see a lot of people who don't have the money to have multiple pairs of shoes.
Okay.
And my philosophy on this is you have to add variety in your training.
Yeah.
So if you have money, good for you. You can have more pairs of shoes. That's good.
Yeah.
But if you don't have the same pair of shoe but vary your surfaces, run on the road, run on the trail, run on grass. If you vary that, you will have, I'm pretty sure, the same effect on injury prevention as if you change your shoe.
Yeah, and that's why sometimes even a little bit of terrain running, off-road running can have a protective effect because you're using your muscles in a different way. Do you think that is a good thing?
Definitely. In the clinic, from what I see from my experience, trail runners tend to be a lot less injured. For overuse injuries, not traumatic, but for overuse injuries, they tend to have less than road runners. And as you say, you use different muscles because you do turns, you do a bit of hills. So you distribute the load to more structures differently. And this way, I'm pretty sure you can increase your total weekly mileage without increasing the likelihood of injury.
Yeah.
So I tend to recommend a lot trail running or just grass running as part of their weekly training, even if there are road runners.
Yeah. So another controversial review by Dr. Nick, which talked about this something called the comfort filter. That a runner knows which is the best shoe for himself, and the intuition is better. So do you think we should let the runners decide by themselves rather than being too prescriptive, or do you think it's too simplistic, that concept?
It is definitely too simplistic.
Yeah.
The comfort filter, I understand the concept, but it's not what's happening right now. If a runner goes into a retail shoe store, they will not choose based on their comfort. They will choose based on what the retailer is giving them to try on, and they will never ever, like 99% of the time, suggest them minimalist shoes.
Okay.
That's the problem.
Yeah.
They will suggest them a big bulky shoe with motion control technology, either in one brand or another brand, but never ever they will suggest them a minimalist shoe. So if you say they select their shoe based on their comfort, yes, but based on trying 3 or 4 different shoes that look a lot like big technologic shoes, and if they would be allowed to try on minimalist shoes, maybe I would change my mind, but it's never happening. The marketing right now is driving what runners wear. It's not necessarily what runners want.
And sometimes they use trendy words like smooth, and I read somewhere they're marketing shoes like cars, so they're using all the trendy words and different phrases which might not mean anything on the injury prevention, isn't it?
It doesn't mean anything, and the reason is simple. The companies, they just don't want to say you will be less injured, first because it's not true, second because they don't want to get sued for this.
Yeah.
So they just say, when your shoe is called a Nimbus or it's the name of a cloud, it sounds very soft.
Yeah.
So it's just like messages in your head, but it's never about injury prevention.
Yeah. Really. So let's talk about your great piece of work which you've done with your group, which is the consensus definition. Because before this piece, there was hardly any consensus on what a minimalistic shoe was. So I think you linked up nearly 42 experts from 11 countries. Must not be an easy task getting their agreement. And the thing I like about this review is it's quite straightforward. You're looking at 5 areas, looking at flexibility, heel top ratio, and you got a combined score of 100%. So I think it's easily reproducible as well. So for the listeners who are not aware of the different 5 components, could you briefly explain what are the 3 components of the Minimalistic Index?
Yes. So the expert determined that the 5 key components to determine the degree of minimalism of a running shoe from 0% to 100%, 100% being the most minimalist, are, as you said, the height at the heel, the differential between the height at the heel and the toes, flexibility, the technology, and the weight.
Okay.
So for sure, if viewers want to have a better information and explanation, it's all in an appendix in the paper, and it's all available for free. It's open access. They have pictures of how to do it and so on. But basically, weight is very simple. And you have to have the real score of the shoe, a size 9 US.
Yeah.
I think it's a size 8 UK.
Yeah.
So if you use this shoe, you put it on a scale and get the weight. So very simple, the weight in grams.
Yeah.
If you get, for example, lower than 125 grams, you score max for the weight. So it's the most minimalist.
Yeah.
That's the first of the criteria. Second one is the stack height.
Yeah.
Which is the height. The difference between the heel and the ground when your foot is in the shoe. So you have to use a small instrument, a caliper that gives you this measurement in millimeters. And let's say your shoe has less than 8 millimeters, you will score maximum, and it's very, very thin, so you'll score maximum on the degree of minimalism. Then we get to the heel to toe drop, which is the difference. It's the slope on your shoe, basically. So high heels have a very high heel to toe drop. So the difference in millimeters between the height of your heel and the height at your toes. Pretty much all the shoes have this differential. So you do the difference between with the caliper, you measure at the front, and you measure at the heel, and you do the difference. If you have less than 1 millimeter, then you get a full 5 out of 5 score for higher degree of minimalism. Then we have the technologies and the experts, and it was a tough one to determine what were the best technologies to look at. But basically, these are the technologies that will somehow restrict or change the motion of the shoe, of your foot within the shoe. So, for example, a rigid heel counter. So you look at the heel. Is it maintained? Is it if you hit on the heel of the shoe, is it rigid or not? Motion control, like dual density in the shoe that we can see usually with different colors, plastic devices in the midsole, that kind of stuff. So depending on the number of technologies that the shoe has, the least amount of technologies, the higher the score. And finally, we have the flexibility of the shoe, because the stiffer the shoe, the more it will restrict your foot's natural movement and interaction with the ground. So we use two different types of flexibility, which are longitudinal flexibility. It's bending the shoe from the rear to the front.
Yeah.
Have a total flexibility as well, and we rate based on the angles and so on.
Yeah, I think for the listeners, as you mentioned, I would strongly recommend to look at the appendix. You've given that with good photographs. It's pretty straightforward to understand and to replicate. So there's and as you mentioned, it's open access as well. One of the things which really interested me was the heel drop ratio, because that's something which I give a lot of importance. And you must know this work by I don't know whether I'm saying this right, by Gendelloni from the University of Lyon in France, where he looked into two groups, where they looked into training somebody for midfoot training, and the other group was just reducing the heel drop ratio. And what they found out was it is easier to reduce the load by changing the heel drop rather than by changing foot strike. What's your views on that? Is it something you would agree with?
Her name is Marlène Giandolini.
Yeah, so thanks for correcting.
Yeah, that's fine.
Yeah.
Well, actually, for me, the heel to toe drop right now in the marketing is one of the big trends.
Okay.
The companies use it to say, for example, oh, this shoe is minimal.
Yeah.
It's minimalist because the drop is 4 millimeters.
Yeah.
But you look at the Hoka shoes.
Yeah.
The Hoka shoes are advertised as low drop shoes, but are they minimalist? The answer is no, obviously.
Yeah.
So that's why we created this index. You have to consider all the factors to say if your shoe is minimalist or not. So in their study, they considered only the drop.
Yeah.
And for me to be able to change the gait pattern, the best way to do so is by changing all of these 5 factors. So you limit the interference between the foot and the ground.
Yeah.
And this way you'll have more success.
Yeah.
So just changing the drop, if you keep a big stack height, so big height at the heel, it will not work because your foot will not feel the ground.
Yeah. So I think that maybe you would agree the whole idea of minimalist shoe is to not to restrict the natural motion of the shoe and try to replicate barefoot running. But the big question is minimalistic or lightweight shoe the same as running barefoot, And there's obviously research by Jason Bonacci from Australia, where he says that, running in a minimalistic shoe is not the same as running barefoot, because the biomechanics are different. And prescription of minimalistic shoe as a mechanism to change running biomechanics may not be justified. Do you think it's a bit too harsh?
No, I think it's true because barefoot is barefoot. And as soon as you put an interference, minimalist, very minimalist, even 5 fingers, your skin will not feel the ground. And you have afferent feedback, so signals coming from your foot to your brain, with shearing forces and so on, that will help you to minimize the impact if you're completely barefoot.
Yeah.
So for this, I will totally agree.
Yeah.
The problem that we have, and that's exactly one of the purpose of the Minimalist Index, is that some research say minimalist shoes do not do this, and some say minimalist shoes do this.
Yeah.
But the shoes that they use were completely different. And the index provides us some insight on the degree of minimalism needed to achieve these changes. So basically, and we need more research on that, and that's one of the objectives that we had with the index, is what happens depending on the degree of minimalism. And there was a good study lately published by Roberto Squadron, different types of shoes, and it showed exactly this. So depending on, and they didn't provide the minimalist index because it was not available at that time. But the more minimalist was the shoe, the higher were the greater were the changes that resemble more closely to barefoot running.
And do you think that's something which you hope for the running companies to pick it up, like, because it's pretty simple scale, looking from 0 to 100%, do you think that could be an incentive for the companies to pick it up, to give a clear message to the runners?
That would be great. That's also our goal is to educate the public, and how to educate runners would be obviously to put that score on the running shoe box directly. Well, I'm pretty sure it will not happen because most companies will not like to have a lower score because it's not a score of quality, but it can be seen as if it was a score of quality,
Yeah.
and it's not. So if your shoe score 15%,
Mm.
will it help you to sell the shoe? Probably not. So for me, I hope that at least minimalist shoe companies will put that score on their box. That's one thing. And I hope that running shoe retailers that have a control on what they say to their runners coming in will just beside like the model of the shoe on the shoe rack and the price, they will write the percentage. And we have some retailers here in Canada that started to do this very lately.
Okay.
So it's still very efficient. It's not written on the box, but it's written on the shoe rack.
Yeah.
So people, the shoe wall, so people can see that right away.
Yeah. And, from a practical point of view, is one of the key concerns is the safety. And we are always worried about increased load on the calf muscles and, the foot complex when you're making a transition. And we got this sort of nice little article by Wiley and Irene Davis, which looked into the kinematic and kinetic comparisons of running in standard and minimalistic shoes. So the thing which can be worrying for some runners is during that accommodation period, during the first month or two, there is increased load because of the transition. So they are theoretically a higher risk of injury. Is it something we should warn our runners when they make the transition?
Definitely. Yes, absolutely. When I see a runner and I have them to transfer from, let's say, a Minimalist Index score of 20% to another one of 70%, and that's the goal of the scale, is you have a difference of 50%. So what I tell them, and currently we have no research on that and we need some, is what would be the average transition time for a runner for every, let's say, 10% change in the shoe score. And what I say to my patient right now is you should allow 1 month of transition for every 10% or 20 maybe, but 10% of change for the score.
Okay.
So you switch to a 20% to a 70%, that's a 50% change. So you need 5 months to do your whole training with your new shoe. And I'm pretty sure it's the way to prevent injuries. And the injuries are always the same. If you transition too quickly to more minimalist shoes, as you said, the calf muscle will have some soreness.
And also issues on the tendon.
So it's always the same injuries. So tib post tendon, the foot bones, the Achilles tendon, the calf muscle. They don't get injured more to the knee. They don't get injured more to the hip. They don't get injured more to the lower back. And it's always the same because the load is transferred. So they need to be cautious. Runners need to be cautious with that. And the problem, if you allow me to go this way, the problem is when the minimalist trend was a little bit bigger, the people were getting injured to their foot. Right? So they associated the injury with the running shoe directly. And based on that, the companies and the retailers were saying, it's no good to run in minimalist shoes because you get more injuries. But what would happen if everybody was used to minimalist all of a sudden to technologic cushion shoes? They wouldn't get injured to which part? The knee, the hip, and the lower back. And they would probably not associate as directly the injury to the shoe because it's more proximal. You increase the load in these areas, but with minimalist shoes, you increase the load in the foot, the calf, and the ankle.
And one of the problems I see is when people make the transition, some runners don't naturally change their foot strike. For example, some become softer and some people still are heavy heel strikers, So do you think when you change the shoes, it should be accompanied by a period of gait retraining, a supervised sort of thing? What do you think of that?
Actually, in the clinic, the higher the minimalist index, the higher the percentage of people that will by their own, without external other feedback, will change their running gait to be closer to barefoot. But as you say, there's always some people who need additional feedback. So I'll have them most of the time If it's not working just with the shoe, I'll have them to have the other cues like increase your step frequency and run softer, do less noise when you run.
Yeah.
So for some runners, it is needed. Yes.
Yeah. And see, most of the work on shoes and the heel strike has been on the asymptomatic population. Do you think we should be more cautious when we're dealing with the injured runner, especially in transition to minimalism, because we can't directly extrapolate that from an asymptomatic population to a recently injured runner?
Yes. In the clinic, if I get a runner with knee pain, what I want to do is reduce the load at the knee. So I'll switch to more minimalist shoes, that's for sure.
Yeah.
So I use the shoes clinically for symptomatic runners for specific conditions. So knee, hip, lower back injuries. But for Achilles tendon, it depends. If it's an acute injury, I will not transfer them, that's for sure.
Yeah.
But if it's a chronic injury, like a persistent Achilles tendon injury, according to the literature, the best way to improve the symptoms is to load the tendon.
Yeah, get it stronger.
Even though it can be, a little counterintuitive, I will switch these runners to more minimalist shoes to have them load their Achilles tendon with higher loads. So I will use that. But if they're injured to their foot, plantar fascia, acutely, I will not switch them.
Yeah,
and I need more research on that, but I definitely use it in the clinic.
Yeah, let's put that as while we are sort of finishing, looking at the practical application. So suppose you get a runner who's preparing for a marathon, who's have a heavy heel strike, and he has a history of knee pain on and off, and you think one of the strategies which you think is to reduce that load on the knee. So as a therapist, how would you support this patient on the transition with the sort of stage-by-stage progression? Could you put that sort of in a brief outline? So how do you do that?
It depends on a lot of factors. The first one is how much time is left before the marathon. If the marathon is in 4 weeks, I will not change their shoe, that's for sure.
Let's say you got like 3-4 months.
3-4 months for a full marathon. 4 months would be my I would say my limit. If it's 3 months, they still might get increased likelihood of transition.
Okay, let's go with your 4 months. So let's say we got the time. Then
so 4 months for me, if you're transferring to more minimalism, you will do for your first training, you will add like 1-2 minutes. You will start with 1 or 2 minutes with your new minimalist shoe, and then you will do the rest of your training. You'll maintain with all the rest of education and so on, but you will maintain let's say the rest of your training with your usual shoe. The day after or your training after, you'll add 1 or maybe 2 minutes. So for every training, you will add 1 or 2 minutes to start with, to start your training with your new minimalist shoe. And you will always complete your training as you're supposed to with your maximalist shoes. So this way, I know that I'm not overloading by transitioning. I'm not overloading the knee, the calf, the ankle, not the knee, sorry, the foot, the calf and the ankle. But I will have them to still maintain their training and still gradually unloading. For sure, I will add some other things, other tips like cadence and that type of advice. But for the shoe, transitioning has to be very gradual. So the 1 minute or 2 minutes maximum per training is generally my rule. If they feel fine, they have no pain, no soreness, they can transition quicker than that. But typically that will be my transition. And
do you add some strengthening work for your calf or something like your foot and ankle or something to supplement that transition? Do you do anything to make that?
Just for transitioning, if it's let's say it's someone with knee pain, no, I will not. I'm pretty sure that all these structures will automatically be stronger and adapt just by doing the transition, because the calf is working more, the ankle is working more, the plantar fascia will get stronger as well. So I have them to just do the transition, but because if I give them additional strengthening, they will load even more these structures. So I prefer them to transition quicker without loading aside from their training.
So on that, and if talking from the evidence, which I'm sure like you're up to date on, what would you say is the role of minimalistic shoes in injury prevention in runners as a blanket sort of gross statement? What would you say that?
In beginners, if you start a running program, for me, if you want to prevent injuries, you should start with minimalist shoes. The reason why is you'll be more likely to have a running gait pattern that is has less impact and that is more protective in the longer term.
Mm.
And you will, I'm pretty sure, strengthen your foot structures, your calf muscle, and your ankle structure. So you will get stronger for the longer term by starting with minimalist shoes. That's an opinion.
Yeah.
There's no research on this currently, but I'm pretty sure it's the case.
What about the experience? How about the experience runner? Somebody who's running for 20 years in a well-cushioned shoes. What do you say to them?
I will ask other question. First question, yes. Are you used to your maximalist shoes? The answer is yes. Okay. Second question, are you injured right now? If the answer is no, I'm not injured, then I ask a third question. Do you want to improve your performance or not? Because the weight of the shoe is a determinant factor of performance.
Yeah.
If they say no, I'm fine. I just run for health. I run to just for fun. I will not have them to change their shoes because they're fully adapted to their shoes, and there is no reason why I would change them. If they tell me I want to perform better, I'm not injured, I used to my maximalist shoes, I will tell them, okay, you need to reduce the weight of your shoe, and the way to go is to go with more minimalist shoe, not necessarily the higher level of minimalist, but to a certain extent to go to more light trainers and lighter shoes.
Yeah, okay. And this, as you know, there's a recent trend for more maximal cushion, like the Hoka and the ultra running and things like that. What's your thoughts on that?
I don't get it. I get it for specific populations. This shoe, the Hoka shoe, was invented more for trail running at first. If you do ultra trail, ultra marathons in trails, maybe your weakest link is your foot. So maybe after 80 miles in the woods, you need to protect your foot. So why not? Yes, I'm a bit skeptical about the benefits of these shoes on the longer term, and I have confidence in nature and in the way the body is built, and I don't think that's on the longer term. I don't think that's the way to go, and it will probably be just like minimalist shoes was. A lot of people call that a trend. I think that we should in the future go back to that trend, which is not a trend, which is actually the way we were built to run. But the Hoka shoes is, I'm pretty sure, a trend. Not just Hoka, but highly cushioned shoes.
Maybe, as you said, it might be for a very small group like the ultramarathon runners, where the stress fractures are very high, isn't it? So that's one of the biggest problems with those sort of group, What sort of research are you now involved? Because we got this few articles. What are the things you'll be involved in the future, so that listeners might be aware of that? We can expect more work from your group.
Yeah. So my main research project right now is my PhD project that we are currently close to finishing data collection. It's a randomized control trial. So basically, we're having 3 different groups of runners with patellofemoral pain syndrome. We're splitting an intervention that was shown in a previous research, my master's project, to be successful. So that was a combination of education, exercises, and gait retraining. And now we're splitting that intervention into 3 groups. We have the first group, which is education only. Second group is education plus exercises. And third group is education plus gait retraining. And we're looking at maybe there's one component that is responsible for more improvement. And for now, I can give you a little insight. That's the results that I presented at the last patellofemoral pain research retreat, is that education is probably the main factor responsible for improvement. And currently, the 3 groups, they have the same improvement in pain, symptoms, and function. So that's the main project I'm involved with right now. The other thing that I do is specifically in symptomatic people. So I have a group of people with runners with patellofemoral pain, and I have them to try on different gait retraining cues. So I'll tell them to increase their cadence, let's say by 10%, to decrease by 10% to compare, to go to the 180 steps per minute that we can hear about. Forefoot striking, midfoot striking, run softer, and we're comparing what happens with the mechanics of running with all these things compared together, and also with the symptoms. because they're symptomatic.
Yeah.
So that's what we're involved in right now.
Yeah, and the RCT, when is the results coming out? When do you expect that to be sort of published
Uh,
or coming out?
yeah, so it's an intervention of it's a duration of 8 weeks.
Yeah.
So people go in physiotherapy for 8 weeks,
Mm.
and we have a follow-up of 3 months after the end of the program.
Yeah.
Right now, we have 52 runners who already finished the process.
Mm.
Our total sample will be 69, and currently we have 65 that are recruited.
Yeah.
So 52 have already finished. We have 13 in the process, and we need 4 more. So it will all be over. Data collection for the 8-week intervention will be over in February, and 3 months after we'll have the rest of the results.
Yeah.
So in May.
So just as a final question, as you know, the running research has really exploded in the last 10-15 years. How do you see the direction in the future? What sort of things will you think more research coming out in the future? Just as your thoughts.
My thoughts as a clinician is that I think we focus a lot too much on biomechanics.
Yeah.
Biomechanics is important, but I think that we should focus a lot more on interventions. So what is really working in the clinic and why is it working? The mechanisms for the interventions to work. And I think that we should focus more on prospective study. And I know prospective study for viewers who don't know what that is to take a cohort of runners, to assess them at baseline, to follow them through time, and to see who is injured and why were they injured. Is there any related factors any risk factors? So I think we need to go this way, but it's very costly to do, and it's very time consuming to do. So it's tougher because right now we have a lot of cross-sectional studies, and it's fine to have cross-sectional studies. The one that we discussed earlier was the cross-sectional study, but it does not give insight on causation of injury. And I think. As I said, biomechanics is probably a bit too big. I think we should look a lot more at training loads. As I said in our previous interview, most of the runners who come to see me in the clinic, they say that they changed something recently. So it's a transient increase in load that have them injured, and not necessarily their
biomechanics or
a deduction angle. You know.
So I think you mentioned about your details, contact details, and about your course and all that in the previous episode. For people who are listening for this episode, could you just give a bit of contact details where they can know more about you and the courses and all the good information you put out there?
Yep. So about me, about the research, my profile on the ResearchGate, very easy. You can have access to the research there. My Twitter account, so at JF Esculier. With that, you'll have sometimes debate and sometimes research reports, that kind of stuff. And also for all information on courses for health professionals, it's therunningclinic.com. So therunningclinic.com has a lot of information for recreational runners or health professionals. So have a look at that.
Thanks, Jean-Francois. You've given a lot of great insights, and obviously it's good. Like we disagreed on few things because there's no black and white in running injuries, and it's always good to have that healthy debate among clinicians. And we are hoping for more answers in the future. And thanks, we really appreciate for you to taking the time. Thanks, JF.
Thanks a lot, Ben. I really appreciate your time. So thanks for the discussion.
Thanks. On the interview with Jean-Francois Esculier, useful with all the clinical tips on shoes minimalism. If in the UK you're interested in the 2-day running course, looking at evidence-based movement screening, running analysis, and strength and conditioning for runners, you'll be interested in our Physio UK course, looking at all the key areas which have been linked up with injury prevention. Further details is on the website. Day 1, we look into the validated methods on movement screening and specific application of strength training. And the day 2 is progression, looking into plyometrics, dynamic mobility, and also the importance of running retraining. We're looking into all the software and the practical aspects linked with running retraining with practical demonstration. I hope you found this webinar useful, and thank you for listening.